let me turn to Dr. Redfield, because this relates to contact tracing. And I think that this is a very, very key part of how we move forward into getting people back to work, getting people back to school. Right now, we have about 100 people that are involved in contact tracing in Alaska. That's clearly not sufficient. There's been talk about a national strategy, but I think we recognize that we have teams in place, whether it's AmeriCorps, whether it's Peace Corps, whether it's our public health corps. What more do we need to be doing to make sure that once you've been tested positive, you know then what happens after that? Who else needs to be brought into this? And I'm not convinced that we're focusing enough on that aspect of how we move to reopening if we haven't done the contact tracing.
Thank you very much, Senator. I want to just reemphasize what you said. I think contact tracing capabilities is critical. It's going to be the difference from succeeding in containing this outbreak from once again causing wide-scale community transmission or not. We're positioned, as you know, to deploy, redeploy the number of CDC, over 500 CDC individuals. We have another over about 650 that we're trying to put into our foundation. But most importantly, we're trying to work with your health department with the resources that we've been able to give because of the Congress supplementals. Also, as you mentioned, with these other agencies, with LabCorp, with AmeriCorps, with the Census Bureau, to work together and have the state develop their tracing capacity. Some states have reallocated state work. Some states have reallocated National Guard while they begin to do this. But I agree with you, and I said it's going to be a significant effort to build the contact tracing capacity that we need in this nation. It will be state by state, but it's going to need to be augmented, probably in your state, from what you just said, at least 5 to 10-fold. And we're there to work with the states to help them get that accomplished. That needs to get in place before September.